Well, Miller Park can fit just more than 40,000 people. Now imagine the stadium is filled about 3/4 full. Imagine then that all of the people are cancer specialists. 30,000 of them have gathered in Chicago to learn about the latest advances and progress in treating cancer. And joining us from that annual meeting of the American Society of Clinical Oncology is ASCO President-elect Clifford Huddis. Good morning to you, Doctor.
Good morning.
Tell us a little bit about the annual meeting.
The annual meeting is the largest gathering of cancer experts and researchers and specialists in the entire world. We come together once a year to look over one another's data, share our results, and to take them back home to the communities we serve all over the world.
What are some of the most important, I guess, breakthroughs as you see it for the year 2013?
I'm always careful about this because we see breakthroughs in every area of cancer, and there are specialty groups focused on all of them within our meeting. But I think the themes for this year that are really exciting are we're really showing for the first time our ability to manipulate our body's immune system to actually treat cancer, a long-sought dream. And at the other end of the spectrum, we showed the ability to take some of our advances now back even to low-income countries and apply them to populations that have not been able to benefit from all of our treatments in the past.
How do you think those findings will affect patients?
Well, it's acute. The ability to treat advanced melanoma, which has historically been very, very difficult, is really changing quickly because we have multiple drugs, some of which are already approved, that turn on the immune system and allow patients with that advanced disease to live much longer. So we're going to see an immediate change in the way that patients with melanoma experience their disease.
You think about and you talk about new techniques, you discuss these findings. How long is it, generally speaking, before they become part of everyday treatments?
It's faster than ever before, and there are several reasons. One is that some of the drugs that we're studying here are being studied in combination, but they're already approved. So once these results are publicized, doctors can apply them. The second is our FDA is working faster than ever, and they even have a special program called Breakthroughs to try to move these drugs into the clinic faster than historically.
What about breast cancer in particular? Are you finding more about prevention?
Well, I in fact spend my professional life focused on breast cancer, and breast cancer prevention is an area of great exciting advance. Not only do we know the genetic causes of some breast cancers, but we're beginning to understand some of the lifestyle causes as well, and that allows us to talk meaningfully about prevention.
What about quality of life? Do you discuss ways to maximize a patient's quality of life if they've been diagnosed with cancer and maybe are suffering with some advanced treatments?
Well, this is a really critical issue for us all the time. Quality of life is why we treat patients, and especially with regard to advanced cancer. So many of the new targeted therapies that we're so excited about scientifically have the added bonus of having fewer and more narrow side effects, so that patients in fact have better quality of life. But this is a key issue for all of us treating patients with cancer.
What about recurrence, doctor? I think it's got to be so deflating for cancer patients when they feel like they've battled cancer and come out on the other side cancer-free. That recurrence, I think, would be a really difficult diagnosis. Are there advances there?
There are many, many advances, not only to treat those recurrences, but to prevent them in the first place. One of the exciting results here at the meeting was the discovery that 10 years of tamoxifen, an old therapy for breast cancer, is better than 5 because it reduces those late recurrences. I'll just point out that for you and anybody who's watching, we have a great resource on the web at cancer.net, which has lots of these results translated into terms that everybody can understand.
That's just what I was going to ask you. Is, you know, you're so accustomed to talking on a technical level. I was wondering for the average person, maybe someone who's already been diagnosed with cancer, how can you get more information to find out what all of these findings and these new treatments mean to each person as an individual?
Cancer.net is divided into areas for every kind of cancer. It includes quality of life and survivorship issues. So it's really a rich resource which I encourage people to take a careful look at.
This is exciting news, Doctor. Thanks for joining us on the Morning Blend to discuss it.
Thanks for having me.
Absolutely. For more information, you can check out the website asco.org.